I'm Megan Montalvo with DIA Health Facilities Division. I'm a management analyst. Thank you for joining our Lunch and Learn. I do apologize about the technical issues. I want to go over some housekeeping items. Please mute your phone or your computer during this time. If you have any questions, please type them in the chat. And we'll answer them at the end of the presentation. If we can't, then we will keep a parking lot and respond to you afterwards. If you have any ideas for future lunch and learns or a newsletter, please email me or contact me. I'll put in my name and my email and phone number in the chat. So today I'm going to introduce Tracy Herrick. Tracy acquired her bachelor's at Purdue University in criminal justice and forensic psychology. She has an extensive background, including nursing and administration. Tracy started with the Health Facilities Division in December of 2020.
Hello, everyone, and welcome. Thank you for being on this Lunch and Learn. Today, we're just going to talk about the overview of the survey process, including staff vaccination requirements for COVID-19. But in the meantime, did you know there's 126 critical access hospitals and hospitals in Iowa? If the DIA visits you at your facility, there's three main reasons that they would visit you. One, complaint incident investigations. Now keep this in mind. This could involve emergency medical treatment and labor act, EMTALA, and abuse. The second would be recertification, which is what we're going to discuss today on these slides. Also validation, and the third is revisits. What comes next is when the DIA surveyor or surveyors show up at your facility, please meet them as quickly as possible. Each surveyor should present you with a business card, and if they do not, please ask for one. Surveyors will need a private room to conduct their survey activity. An entrance conference will be held once they get settled, and we encourage you to invite whomever you'd like to join. The surveyors at that time will request a list of documents. One of those documents will be a database for the hospital to fill out and return to the lead DIA surveyor as soon as possible. If you have any questions about that database, your chief financial officer should have a copy and help you through that, but please ensure the information is up to date. In that list, there'll be titles. Each one would be like this one, governing body, which would include the bylaws, network agreement, a list of all patient services furnished under all agreements and arrangements, including the nature and scope of services provided, a list of names and locations of all off-site locations providing services under the provider transaction access number or the hospital CMS certification number. That's like sleep study, wound clinic, chemo, infusions, clinics, anything that would be billed under the hospital. An organizational chart, including full names, titles, and phone numbers and managers for each of those departments. Committee meeting minutes, including policy development and governing board over the past 12 months. The next title would be medical staff, which we need the bylaws for medical staff, the rules and the regulations, credentialing, external peer review policies. Also current roster of medical staff, including their specialties and medical staff categories. Medical staff meeting minutes over the past 12 months. Mid-level and physician chart review policy. And then there's quality improvement and assurance. This would include current hospital-wide plan, committee meeting minutes over the past 12 months, department and service quality improvement or quality assurance activity reports, including medical staff, annual call program evaluation, including policy and procedure. The next would be personnel. There we need the list of the hospital cost staff with their full names, job title, and hire date. Please don't include staff who are separately certified in areas like hospice, clinic, home care. We also need a list of all contracted staff that provide services for the hospital or call. We need a list of volunteers. Please include the areas in which they do volunteer in. Then there's other documents. A census will need for each day we're at the survey, operating room schedule for the current week, variance reports for medication errors over the last 12 months, organ donor procurement agreement and educational records, infectious control and committee meeting minutes the past 12 months, program information related to prevention and control of hospital-acquired infections and other infectious diseases, and for the optimization of antibiotic use through stewardship. There's also a packet of information that you give patients. This may include swing bed patients, if applicable, including patient rights, abuse and dental service policies, water management plan, its policies, emergency fuel and water agreements, COVID-19 policies and procedures for staff vaccinations, which we'll discuss later in more detail on a few more slides down. Then there's policies and procedures. We need the visitation policy, policy index for administration and all other services provided. And then we also need closed records for the past 12 months, a list of those. We need 5 swing beds, if applicable, 5 medical charts, 5 surgical charts. Now, these will be selected from the OR log by the surveyor. 5 emergency room charts. These will also be selected by the surveyor from the ER log. 3 death records, 4 OB records, if applicable. That would include 2 deliveries, 2 C-sections, include the records of the patients admitted by mid-level practitioners as well. These are a few of the requested documents the surveyors will ask for. Next, the surveyors will ask to take you on a tour throughout the hospital. This will allow your staff to gather the requested documentation. If possible, any large documents that are stored online, please provide access to those documents. When documents arrive, please label them with the corresponding number and letter seen on the document request list so that we can keep track of them as they arrive into the area of the conference, and also they're easily identified. Please provide the surgery and procedure schedule for the week on the date of entry so that the surveyor can choose the surgery or procedure they would like to see. Let us know if any of your administrative staff will be unavailable that week. Now we're going to discuss about the COVID-19 healthcare staff vaccination, which is a QSO 2207 ALL hospital and call. During the entrance conference, surveyors will ask facilities to provide vaccination policy and procedures, and the policies and procedures would include a minimum, including but not limited to, the process for ensuring all staff, required staff, have received 1 dose of COVID-19 before staff provide any care, treatment, or other services of the facility and patients, process for ensuring all staff are fully vaccinated, process for ensuring the facility continues to follow all standards of infection prevention and control practice, a process for tracking and documenting COVID-19 vaccination status for all required staff, including staff with exemptions, process for ensuring all staff obtain a recommended booster dose with the recommended timing of such doses, process of how staff may request vaccination exceptions based on recognized clinical contradictions or applicable federal laws such as a religious beliefs or other accommodations, a process for tracking and documenting of the vaccination status of staff who must be temporarily delayed as recommended by the CDC, a contingency plan for staff that are not yet vaccinated. Providers must provide a list of all staff and their vaccination status, which shall include but not limited to percentage of unvaccinated staff, including those that are approved exemptions. You must identify any staff members remaining unvaccinated due to medical or religious exemptions. Identify all staff hired within the last 60 days. A list must indicate the position or the role of each staff member. And the surveyor will then review the policy and procedures to ensure all components are present. Review all contingency plans developed to mitigate the spread of COVID-19 infection. Select a sample of staff based on a current staff sample selected guidelines, which will include vaccinated and unvaccinated staff, if applicable, with specific requirements. They can be found in cms.gov. Remember, we're all in this together. Now we're going to take time for questions. Thank you.
Anybody have any questions? In our newsletter that will be coming out on the 20th, we will provide a link for this meeting. And so you'll be able to see the slide and review this meeting as well. Oh, I'm sorry. The question was, will the slide deck be available?
Let's put in her phone number and her email address in the chat. Those of you that would like to contact her for further information on the slides.
Any other questions, concerns? Any ideas for future newsletters or lunch and learns? We would love to get feedback for. Because we want to know what you want to learn about or updates to programs and things. We want to know what you want to hear about.
Well, also, if any of you know of anybody that would like to be on these lunch and learns or have access to watch any of the lunch and learns, please let us know. Because it would help with the information we have to provide.
Absolutely. And if you want to send me an email at my email address, I can send you the link to subscribe to our monthly newsletter. Comes out every month on the 20th. Right now, our next lunch and learn will be scheduled for June. And all the information for the lunch and learn will come out in the May newsletter for the link, just as today's was. There are no questions. We'll probably stay on here for the next 5 minutes until noon. So if you have any questions, you can definitely type in the chat. And we'll stick around to see what you have.
Thank you, Lisa.